Hello, it's Dr. Hampton here. Welcome to my channel. I am here with the co-founder of Low Carb USA and a volunteer for the Society of Metabolic Health Practitioners, and that is Pam Devine. And there are so many people who are interested in carb restriction as a key to achieving metabolic health. But help is on the way because the Society of Metabolic Health Practitioners is here to kind of help provide some guidance. And I just wanted to make sure that we were all aware of all the wonderful resources that are available on the website. So Pam's here to help walk us through that website, give us a little bit of a tour. But before we get started, I just want to hear a little bit about why this society was created in the first place. So Pam, give me some tips, give me some thoughts on why the society was created.
I really appreciate the opportunity. Thank you, Tony. One of our last live conferences for Low Carb USA was in Florida, Boca Raton. And Tro Kalajian was speaking with us for the first time. And he took me aside at the registration table and he says, what we really need is a society. We need to all come together as a community. We need to have an overseeing governing body. We need to have a support. We need a validity. We need all of the things to come together. We need science in one place. We need all of this information for people, and it needs to be a nonprofit. And I think you guys would be the ones to do it. I just see, you have some things with Low Carb USA. Doug Reynolds is so good at putting this together and working on this aspect of the community and bringing people together. And then he continued to go on, we talked about it a little bit more, and then he continued over the next few months to talk about it online, and Doug saw him. But I had been trying to bring them together with that conversation through that weekend. And Doug says, hey, Tro, I could probably help you with that. And so he ended up volunteering to Tro and saying, hey, let's work on putting it together. So they put their heads together to think, what does the society need to have available to the community? How do you form it? And so it's a little bit like a COVID baby. Doug literally started this on March 2020. Right. Wow. As the pandemic was hitting. We just got back from the Denver conference with Jeff Gerber. And he put his head down and he says, okay, I'm going to start a nonprofit. I've talked to a number of people about the difficulty, the challenge to put a nonprofit together. He says, okay, but I'm going to take that challenge on and I want to see what it takes. And he started researching and doing the steps needed to put a nonprofit together. So that's in the very first section.
Yeah, I can see that. So if we go to the website, I see a mission statement, and it states that the Society of Metabolic Health Practitioners represents all researchers and practitioners working to improve metabolic health around the world through education, training, and support of evidence-based nutritional approaches, including, of course, carbohydrate restriction as a valid therapeutic intervention. You would think that would be a obvious statement to make, but because we are still living in a world where carb restriction is not necessarily understood, it's important that you make that type of statement. And I appreciate that mission statement. I noticed that you do right after that have your board of directors, and here they are. So tell me a little bit about the people who are on the board and any role that they may play.
Doug very carefully selected people that he had gotten to know over the years, people that he trusted, people who could bring different aspects of information to the community from different viewpoints. Doug's the president and founder. There are rules and laws about nonprofits about me being in any official capacity on this. So I'm a volunteer and I'm a founding member, and we'll go into memberships a little bit later. But Heather Pickett. So we met Heather in Denver. She is a retired Air Force colonel. She's also a family practice physician and a DO. So she was brought on board because she's fairly new to the conversation. So she's going to bring that viewpoint of what is somebody and recently who didn't understand therapeutic carbohydrate reduction as an option even. So the word option is even used in our mission statement, not only as a valid intervention, but as an option. So we were talking on another podcast about there can be different things that work for different people. If this is an option for somebody to have in their toolbox when they're taking care of their patients, what will work for their patient, what can they use to offer to them, decide. The patient help, patient's part of that healthcare team. They're going to decide what are they up for, what are they what are they willing and not willing to do, but they need to be given the right information. So that kind of information can help influence the patient's decision. So Heather Pickett was brought on. She's the secretary. She oversees the meetings and gets the minutes. She was willing to do that and then bring her expertise and her information. Mark Cucuzella has just been doing such amazing work out in West Virginia as a medical doctor and a family practice physician. He's been able to influence his hospital to make changes within the system to lower what's available in processed foods and sugar. And we want to learn how that can be done across the country and around the world. He still wants to make bigger inroads. He said, well, that was this and it took that. But how to talk to colleagues is a big conversation, how to talk to the institutions that people work for and with, how to bring about change is something that is really important to the SMHP. So Mark brings that. He has a lot of history in writing papers with, we'll get down to Eric Westman. He's not at the bottom because of anything besides alphabetically. So I think, and the next person listed on about us is Miriam Kalamian. She decided to study as a nutrition expert when she wanted to help her son's cancer journey. So it wasn't a recovery, unfortunately, but it gave him a quality of life and extended his life and gave him a quality life that didn't look like it was there. There's actually a really nice article on the SMHP, and as we get to where the articles are, we can go over that a little bit. But she brings a different aspect of metabolic health conversation to around cancer treatment and possibly prevention, if you're looking at it as metabolic health and what are the metabolic influences of cancer might be. She's also a nutritionist, so we liked having the nutritionist aspect on the board. Robert Sivas, he's actually a bariatric surgeon, but also a general surgeon, and his father is a world-renowned cardiothoracic surgery. So he has a history of medical professionalism in his family, but he's also learned low-carb therapeutic carbohydrate reduction, and what he brings to the table is his years of experience, but also his behavioral support. That he might do bariatric surgery for people who need that kind of intervention, and it's all different interventions that he works with. But he really talks about the behavioral support, which is really important, something that we want to highlight a lot. The stuff that we've been talking about, Tony, getting outside, having emotional buoyancy and emotional management systems put into place that aren't just don't eat this and don't eat that, but because some people aren't really easily able to just cut out foods. Some of us find it easier than others to do. Some of it find it more challenging. So we wanted to make sure information like that was here to support practitioners who want to do this and help more patients that way. So he brings years of experience, training and expertise to teaching others.
And I do want to say that wellness is more, as you suggested, more than nutrition. I mean, that's why I say protect your nest. There's so many things beyond the end, the nutrition piece. And the beauty is that if you start working on those other aspects, they will all kind of support each other. They all kind of work together. So nobody should be afraid to get started. The key is let's help coach you along and support you along to help you along. And then of course, if you have a processed food addiction, we need to support you with that as well. We have to say that that's a real thing, and we can help you with that. So it's nice to have a doctor who understands addiction on the team as well. So I appreciate that.
It's very important. I think there's more people who are addicted to carbohydrates and processed food than anyone thinks. Sugar has become so ingrained in our culture, as well as everything that we celebrate, life events and holidays and everything in between, and it's used to show love and all this stuff. So when you're trying to talk about metabolic health from a nutrition standpoint, it's really hard for people to see, well, how do I make those changes? Because they're so culturally ingrained. When you celebrate your first birthday, what do you have?
Right.
So teaching those kind of things, he has a really good influence on that. And talking about addiction is really important. Tro Kalayjian is on the board since he was the one that really started the conversation about needing this kind of an umbrella organization to support each other. He brings his passion, he brings his experience, and his personal story, where he was teaching patients what he was taught, but he unfortunately was getting no success in his weight loss. He was 350 pounds as helping his patients lose weight, and he was so frustrated. He talks about how he felt like a fraud, and he wants to make sure that other physicians like himself have information that will help not only themselves but other people as well. He's now been able to become more athletic. He's running and doing weight training, and he's very impassioned to continue to teach others what he's learned and make sure that it's not learned the hard way.
And he also understands hunger. I've talked to him before about hunger, and he says that if you don't address hunger, then people are going to struggle in their weight loss journey. So I think we want to, again, have clinicians who are not just saying, eat less, move more, and not addressing these root causes that lead to us struggling. So if I'm hungry, I'm going to have a hard time following any dietary plan.
Absolutely.
If I have a processed food addiction, I'm going to have a hard time following any dietary plan. If I don't have anybody coaching me through my journey, I'm going to have a hard time following any dietary plan. So again, it's a all-encompassing approach. And when clinicians understand that, they won't point their fingers at patients saying you're not motivated enough, you don't care. They won't make statements like that because they'll understand this is a struggle. Even when I had Dr. Pata on a episode of a podcast, he was able to share, how being isolated can lead to a struggle. So we have to make sure people are not isolated. And so all of these things will help people understand that this is a journey and we're here to kind of coach you along, which is why we need the society to provide a great resource to help do that.
I love that. People really, they need support in so many different ways. They need social connections. They need connections. If we can do it this way and reach somebody who is not ready to go out and be among the world and the public because they've gotten so ingrained in being isolated because of, like, for one, a pandemic, others that they just don't have finances, or they have mental health issues, or, there's so many things that can be addressed. And if we can bring the story to them, like through stories like this, through other podcasts, through all of these different avenues, and then reach the practitioners who are going to make sure that these are options when someone does come to their office for healthcare.
Absolutely. And I see who's up next, which is Dr. Eric Westman. And before you comment on him, I mentioned when we talked earlier that I just turned in one of my final assignments for my master's in nutrition course. And of course, the paper that I cited was one of his papers with one of his colleagues. So I just wanted to do a shout out to Dr. Eric Westman for helping me to complete my homework.
Well, that's wonderful. He has so much research, and he's been so good at putting research together and getting the research papers out into the hands of those who are looking at it. He tells an interesting story. He has years, decades now of experience, but the way it started was he actually challenged Dr. Atkins on their therapeutic carbohydrate reduction or reduced carb diet and saying, how are you doing this? And how do you say this is working for people? So he actually sat in person. He went to New York and met with Dr. Atkins, and they had a conversation. And, Eric's just like kind of shaking his head. And he says, Dr. Atkins apparently said to him, go ahead and prove me wrong.
Right.
And he couldn't. Everything that he did, the research that followed that challenge, only proved that carbohydrate reduction was very successful in reaching metabolic health, for weight loss, for blood sugar control, for reducing blood pressure, for all of these benefits that he was able to document. So there's lots of research, and he we brought him on board because of that. He has such a big history. He's very science and research is very important to him. He's as well as Dr. Sivas. Dr. Sivas has his PhD. His thesis was on about fatty liver and liver disease, and so they just bring such a really valuable aspect to teaching others and supporting practitioners.
Absolutely. And even as I look at the website, the study that is from the Annals of Internal Medicine that is in where there's a link.
Yes.
I clicked on that was the actual study that I used in my paper. So that was kind of ironic. So
that's amazing. So again, low carbohydrate ketogenic diet versus low fat diet to treat obesity and hyperlipidemia.
That was it. So that's just funny that that's true. So it looks like, let's go to the next category, which is committees. You guys have created 3 committees, one for clinicians, research and education, and of course the outreach committee. I just want to thank you guys for allowing me to be part of the outreach committee and just serving my role in trying to reach communities who may not have heard this information. And there are a lot of social determinants of health that restrict access to care, and sometimes that leads to lack of access to information. So we really want to reach those communities that have not heard this message, and I hope to help work with my colleagues to achieve that goal. But go ahead and tell me a little bit about the 3 committees that have been formed and anything you want to state about that.
Yeah, so I click on About Us and committees, and the first one that comes up is the Outreach Committee with Tony Hampton and Vivian Lowe. She's in the Boston area. She works with the diverse community and has a passion in making changes and reaching people with information who may not be getting it. And Gurpreet Pata, you've mentioned many times, and Doug and I. So we're still getting together kind of our outline of what we want to accomplish, how we want to accomplish it. And then when we put out an article about your belief system and about nests, and that's going to be in the news and resources, but also your passion about reaching more who might not have this information. So the clinician committee, that's actually the majority of the board of advisors for the clinical guidelines. So Adele Height is here listed as the committee chair. Many of the clinical guidelines advisory board is down below the line. A few of the people we've mentioned already. Couldn't have a board of advisors that had international members. So unfortunately, some of these people that we may have invited couldn't be on the board of directors, but they're clinical advisors like David Unwin in the UK and Tim Noakes in South Africa, but Eric Westman, Will Yancey are here. Francisca Spritzler brings the RD perspective again. Georgia Eves, really good with the mental health aspect. Gary Fecky talking about inflammation and the struggles that he went with, really wanting to have a support system and have guidelines and have, like Tim Noakes's, his advisor and legal counsel has done a video that we'll get to when we get to some of the education and the free content that really talks about some of the legal aspects of supporting something, recommending to patients something that might not be considered standard of care or in traditional guidelines, but doesn't necessarily mean that if you don't have science behind something, you can recommend it to your patients as long as you have the conversation like Tony, you're doing. You're saying, I have this information. I want to present this intervention to you. I want to suggest that we reduce your carbohydrates therapeutically, that we do this kind of exercise, that we, do these other kind of things. And this is why I'm showing you this. And this is the information that I have to back it. If you have clinical guidelines, you have research studies and scientific papers. If you're going by information that has science behind it like that, a physician and practitioner is covered in that sense as recommending it to the patient, especially if they agree and sign and say, okay, I'm going based on your recommendations and the evidence that you've given me. This is what we're going to do for my healthcare. Yeah, and we talked about Miriam and Vivian and Nick Norwitz, who's going to be a med student soon. So he's bringing the conversation about how to reach med students while they're in school or just as they're graduating. Make sure this information gets into medical institutions that are teaching our new practitioners how we go about that. It's really important. I know Tony Martinez out of New York has talked a lot about that. He was hoping to run for Senate this year and talk a little bit more about how do we get information in medical schools. But unfortunately, their governing bodies are statewide here in the U.S. So it's a big challenge, but it's one of the topics that we'd like to continue to cover, which I think is under the Research and Education Committee. One of the things that they're going to be addressing is how do we get information into medical schools? How do we get them into curriculums? How do we get them into advanced studies like you're doing, Tony? You've learned a little bit at a time. You've kind of steered your learning and education and awareness based on seeds planted, and then you decided to go down and learn more here, go study nutrition and get a master's in nutrition. But we want to plant those seeds where we can and get that information into the establishments. So Rob Sivers is chairing that with his research background, and he was a professor of the pediatric and fetal surgery at Vanderbilt University in Nashville, Tennessee. He also did some work up in Canada. I was just trying to see, but that's all listed there, his history. But the work that he did for liver disease is really, really fascinating. Goes into a lot more detail on here. We've got Ben Bickman as an advisor on this committee. He's super busy, also going to school like you, getting another degree. And
nice.
Nick Norwitz and Tro Kalasian and Duggar. Gathering research and making sure that some studies are going to be done, some data is collected going further, getting funding for research to be done. They're actually in discussion about forming their own journal. So a journal for Society of Metabolic Health Practitioners. I don't know if they're thinking about a different name, but somewhere, another place where studies can be published. So that's to be announced.
That's good stuff. And you even, I guess all societies have to have bylaws, and the bylaw statement at the top just defines what that is. And, they formally define the society's structure, purpose, and directives, ultimately serving as a roadmap for our actions. Clearly, we have to know where we're going in life, and this is good for people to kind of read through if they want to understand, where exactly is the society going? What exactly is the society trying to achieve? And it's really a big deal. And the reason why I think it's a big deal is because, 70-80% of all chronic illnesses are grounded in metabolic disease. So whether it's the diabetes, hypertension, the dementia, the cancers, the uterine fibroids and things of that nature, polycystic ovarian syndrome, and on and on and on it goes. We would literally, the amount of money we spend on healthcare would be reduced greatly if we can actually, at the minimum, put these things in remission. But even better, some of these conditions can be reversed. And the number of patients I've personally seen get off of insulin and diabetes pills, or get off their blood pressure medicines. And if you think about the cost of treating these conditions, for diabetes in the United States, it could be as much as $16,000 per patient. It's so important that we provide a path, not just to reduce the cost of care, but to, as you stated before, provide hope. And people don't have to have a life of medications. And so having a society that's going to help other clinicians and patients have resources to achieve this is very hopeful. It's hopeful that we will eventually end up in the world that we want to live in. So let's go to the next category, which is news and resources. And when I click on news and resources, I see that there are, news stories, blogs. So talk a little bit about the goals of this section.
There's a lot of stories that can make a difference. People who have a story to share like Nick Norwood, who's going into medical school. But the way he found this was, unfortunately, he had extreme illness that medication wasn't helping, because that was the first line of treatment that he had heard about for ulcerative colitis. He was a young man. He was in between undergrad and graduate school. And he was very active running marathons. He thought he was eating healthy, but he had no idea why he developed ulcerative colitis and what to do about it. So we want to continue to highlight different stories of how and why people found therapeutic carbohydrate reduction, what the benefits possibilities are. And the majority of the ones below Nick's story are clinicians who have been using this in their practice and what they have seen with their patients, what it has done to their practice. Like you just mentioned, bringing hope. Amanda Decker was one of our first female accredited members, and she's now metabolic health practitioner certified and accredited.
I have to comment on her. I did a couple of videos with
Yes.
Amanda, and I'm going to tell you something. I would just ask her a question, and she would provide an answer, right? But the content of her answers made it very clear that she had gotten some education. I mean, it was just clear. She articulated it so well in her depth of understanding. But this is the beauty. She also explained it in a very easy to digest way, right? Because we want more than just a clinician to hear this message. We want that person who can hear it and say, okay, that makes sense to me. So
absolutely.
So clearly the work of educating our colleagues is working, and she's doing a wonderful job in the work that she's doing. So thank you for mentioning her as well.
When people like Amanda write to us, as another gal who's been writing to me, her name's Tia Reed. Andrew Aswari had us in tears. He's one of the next blogs over. When they express the difference that it's made, not only to them personally, but how they feel about their career, how they feel about their practice, being able to make a difference in people's lives, like why they went into the medical field to begin with. It just is so inspiring to both Doug and I, and we can't help but wake up in the morning and think, what else can we do to make more information available to the next person who can also share that with, because the practitioner, that became so important for us to reach, because you see patients every day. You see how many people in one day. And then you just decide that you're going to make a podcast like this to teach others, no matter who they are and wherever they are across the world, and whatever kind of community or whatever kind of lifestyle they're leading, to learn. And you're reaching thousands of people, millions of people at some point, I'm sure. Brian and Tro, they've got 3 million downloads on their podcasts,
That's
and
right.
Amanda's, seeing people every day in her office. And she, when she says things like, it just starts with one person and then it branches out and goes out to community from there. It's just, and when someone says information about nutrition and metabolic health, other parameters that you can work on, has made all the difference. It just is like, it's amazing. And you had, what's the gal's name in New Mexico who works with indigenous? When we were off getting ready to start this, I've decided to listen to podcasts. So I'm outside, I'm getting air, I'm gardening, I'm in, digging in the dirt or trimming things, and I'm in the sun and fresh air. And I listen to these stories and I think, goodness gracious, how do we get up in the morning, we do our job, but how is it that we reach people that make this much difference, that it makes this much difference in someone's life? It's hard to comprehend, because, we're just living our everyday life and we're doing the things that we're inspired to, put pieces together. But then when it does this.
Yeah, well, it was Jamie Sandoval.
Yes, Jamie Sandoval.
And she was episode number 33. And yeah, she's doing wonderful work in New Mexico. And she talked, like I said, like the things she shared about the indigenous communities. And so she has that community. She has the Latin American community that she serves, and she's doing a wonderful job. But again, we are trying to reach everybody, because everybody needs this information. Everybody wants to heal metabolically. Everybody wants to be here with their families as long as possible. And this is one of the ways to do that. And that's why we want to make sure people are aware of the society and just providing a path to heal. And that's all people really want. And I just think that's so important. But we also have to do it in a way where we follow science. So I notice, you also have right under news and blog a science section, and it has scientific papers and published articles. So that's clearly going to be important. And the good news is that we have plenty of science to support the idea that if you do a little bit of a carb restriction approach, you're likely to become metabolically healthy. It's not the only way, but the science does support this way of healing. So it's really good to see that.
Absolutely. And we want to provide the resources that people feel confident with it, that they can see that scientific research validate the information and support decision making.
That's right. And another part of that support is the next category, which is the coaching and mentoring. So the idea that, yes, not only are we we can validate this, we're also gonna hold your hand. And I look at the image on that webpage, and the clinician is talking to the patient and just being there to support her through her journey. So talk a little bit about the mentoring program and what it offers.
So a lot of physicians like yourself, those listening, may not have the amount of time that they need and would like to spend with their patients. So there is this health and coaching and mentoring program. It's an app-based program. It can be referred to just directly, or it can be incorporated into a practice. There's a way to put branding for the practitioner's clinic or the healthcare practice. But it's just so there's coaches who have been trained to support the person based on the kind of support they need. So people have different needs. So some are really easy. They can say, okay, I'm just going to do this, and you tell them what it is and how to do it, and they can do it. Other people have different ways of learning. Other people have different ways of making decisions throughout the day. Maybe they're more emotional. Maybe they're, some people can just do it with a list and they're done. But, some people need a little bit more. And the coaches are really good at determining what kind of personality the patient has or individual who wants to use this, and what are the aspects of support they need. Do they need to start having a different mindset? Do they need to start looking at food as fuel? Do they need to start looking at food so they're not using it as emotional support if something goes wrong or they're stressed? It actually addresses everything that you talk about, Tony: nutrition, exercise, sleep, stress. So it helps people sleep better, that hormonal changes that happen when people sleep better, and the exercising. So there's really good videos. There's apps that's easy for people to take pictures of food, send to their coach, reach out to their coach by text, email, phone call, set up a meeting, stuff like that. So, and it's helping the practitioner who might not have the time to do that, because we were talking about having a healthcare team. Having a coach is often needed and necessary for people. So that's a great program.
No doubt. Well, I have a coach myself. His name is Bill. Shout out to Bill.
Hey, Bill.
And yeah, that's right. He's a leadership coach, and I think we need these things. And one thing that people will learn if you listen to successful people, it could be a celebrity, it could be an athlete, it can be a executive, it could be a housewife, that's trying to take care of her kids. When you have a lifestyle coach, a leadership coach, it really does help to optimize you and fill those gaps. And so no matter where you are in life, coaching, it just makes sense. So having that as part of what you guys do is really foundational, I think, in making sure people are successful. I do see an icon for forums, and it looks like you have to be a member to take advantage of that particular feature, where there's discussions occurring, I assume, right? So any comments on that before we go to the next area?
Yeah, that's actually a really important part of the membership of the society, the discussion forum. So addressing a standard of care around therapeutic carbohydrate reduction, standard of care around certain clinical lab values, or whatever people want to have. They have questions about something they're still learning, something they have a patient that might come with some different outcomes than they were expecting. Just places where people can ask their fellow colleagues questions, start discussions, highlight new information that comes out. different things like that. So, and Eric Westman answered with his expertise the other day, answered somebody who had a question about something. So the board of directors are jumping in. We're still encouraging more to use it, but as we go along, it'll become more and more active. It's a networking place as well. So you can look for people maybe in your area. You can look for people who you might need connections with certain specialty, etc.
Now we have an education section. Again, this may be areas where it's for members.
The grand rounds will be for members only.
Yes.
There are monthly presentations on Zoom currently so that we can reach those of you in your office and homes on a monthly basis with different compelling topics and research. Andrea Salcido was the one we found through Rob Sivas and did a grand rounds. And so important to talk about things that aren't always addressed so that, like you said, you're learning something to pay attention to because you hadn't thought about that aspect of nutrition inducing uterine bleeding that was abnormal.
That's
and fibroids. Not a lot of people think metabolic health contributes to something like that, but so as we can,
it makes logical sense. But I didn't think about it until Dr. Salcido talked about it, and I was like, "Oh yeah, that makes sense. Fibroids is nothing but inflammation. So how could I not?" But she had to think outside the box. And again, the big message for everybody is that we all can be clinicians. We all never settle for, I don't know what this is. We can't help you. There's a reason for everything. And you just have to keep digging. And I think that's really important. So part of what I would like to see in our society is that we go from, just diagnosing things and treating and doing surgery and procedures to, well, why do you have an upset stomach? No, don't just take a pill for it. Well, why did you have to take the pill in the first place? And keep asking why until we have answers. And I think that's what Dr. Salcido did. She was able to kind of question things and not just go with what Dr. Eric Westman or some other, scientist said. She kind of did her own little research study and found some answers. And now we can then share that message with others. So,
and she was good about pointing out any previous studies that had helped her learn. And
that's right.
Different outcomes that said, and Dr. Ben Bakikio just did one. Not a lot of people realize how cardiovascular health is helped with the muscle system. And he talks a lot about resistance training. Well, he came from a research background, a PhD, an exercise. I mean, he was a weightlifter. So, he had exercise and weightlifting in his background, but it's so much more clinically. Like, he's done presentations that talk about how does stimulating this muscle in this certain way release these hormonal changes to encourage metabolic health. How does it release fatty acids to fuel your body system and not feel tired after a workout, but feel energetic? How does it release human growth hormone and increase testosterone? That there's an epidemic of low testosterone in men, and people don't really know. So, how does that get influenced by not only nutrition, because he's very versed in nutrition, but as well as exercise and what type of exercise. So he's real big on resistance training. So those are some of the topics.
Absolutely.
There is a big free training library that nobody has to be a member of, and the CMHE's providers can be accessed by anybody. But yeah, the free training library is something they really want to make sure that everybody knows about. The Nutrition Network, our partners for education, have some free courses there. What is diabetes is within the first one. There's 3. What is diabetes? What is type 2 diabetes? Obesity, and how does it have metabolic dysfunction? How does it influence it? And insulin resistance, described really well. Trocalagian did some really nice grand rounds on these topics that are at the bottom here. Rob Sivas has also got one a little bit to speak to someone who might be a little skeptical and address some of those maybe myths that people have heard. And Jeff Gerber does a really good talk on metabolic syndrome here. There's a few other videos there.
I like videos. I think videos are easy to well, that's why we're making a video right now.
Yeah, right.
A little easier to digest, and sometimes walking through information with some images and a video makes it more palatable. People are busy. They're trying to feed their families, work, and sometimes play. And so when you give them information that's easier to digest, I think it makes a lot of sense. And I see Diet Doctor, I see Nutrition Network. So in other words, we have people who are sharing a similar message. The Obesity Medicine Association, I belong to that as well. So that's good to see that those resources are there to kind of let us know, who kind of aligns with this vision. So that's
Yeah,
pretty
and
good
Doug
stuff.
created the continuing metabolic health education credits those are all will apply to that for the society.
Perfect.
If you attend any of those courses, do any of the curriculum here, attend any of these other conferences, those can be submitted, and they're part of the accreditation process. So CMHEs are required to apply and also to continue the accreditation. So they'll be submitted on an ongoing basis.
That's perfect. So thank you for that. And that's very important. Again, our time is valuable. And if I can spend some of that time getting continuing medical education, for those who are not familiar, continuing medical education is the way we validate that the clinicians who are providing care are keeping up to date. As you could imagine, things change, just like, this knowledge of metabolic health is new to some. So we have to have a way to validate that clinicians are continuing to educate themselves and stay up to date. So thank you for that. Accreditation. What would you like to share about this section?
They're all the same accreditation, so they're going to be going towards having the metabolic health practitioner accreditation. So that's a credential that you would earn that can go after your MD, MHP, public health, whatever your credentials are. But there are several pathways. So there's the courses that can be taken through our partners at the Nutrition Network. And a lot of people who have started learning may have already had those, but there's certain requirements and pathways that need to be gone through. They start with the professional training in LCHF, ketogenic nutrition and treatment. Start with the one specifically for nurses if you're a nurse, or one for dietitian, and they go into the more advanced courses in clinical practice. So there's 3 modules for that. And they just go through the courses. An advisor can also start the pathway here. It doesn't originally have a medical background, take the advisor training and then continue down the rest of this pathway through the previously mentioned ones. And then really important, everybody takes the ethics module and the ethics courses to talk about all the different aspects of what is ethical, what is covered, what we were talking about, what is covered in standard of care and that kind of things, what is covered in patient practice and patient care. And telemedicine is becoming such a big thing these days, especially. So they talk a lot about those kind of legalities around telemedicine and stuff like that.
So there's different ways to get to the target, which is great that you guys decided to honor, where people meet people where they are. And if people have a clinical practice that's allowing them to kind of move towards that goal faster, that's a great path. If
you had research, lots of clinical experience already, you could write in and describe some of your cases and
that's right.
Get that and the research pathway you were just going to mention. Go ahead.
Absolutely. Yeah. Well, I think that's important. We want to encourage research. I certainly have that on my to-do list, hopefully within the next 6 months to a year. And but that's going to be critically important because it'll validate more of the science. We need more and more science. But the memo I want to make sure everybody got is that there's probably more low carb research than any other dietary approach ever, done. So there's plenty of research already out there. The Public Health Collaborative has most of that data collected in one place. So if you want to search that, you'll be able to see the studies that really validate a low carb approach. But we still need more research. For example, is processed food addiction a thing? And if it is, let's do some more research. What about the support that we need for people who have processed food addiction? Is that a thing? Well, we may have to do research to validate that. We may have seen it anecdotally in our practice, but if people are benefiting from that approach, we need to do the research, validate it, and then we can encourage our insurers to cover these things. And that's why it's important to do research, because we have to get the system, the larger system, to honor what that research is saying, and then And then that'll lead to resources going towards that, because ultimately we're all on the same mission, which is to help people heal. But if we have research to support these different ways of looking at it, it'll actually change our current system. So it's nice that you have these accreditations. It's nice that you have these different pathways. And it's also nice when you go to the next category that you have a way to find a provider. Maybe I'm a patient and I live in a certain area and I want to find someone who already knows some of this information. So I see under that category, you have a whole way to search for clinicians. And I'm sure that list will continue to grow, but it's good that you guys have addressed that issue as well.
It's growing every day. It's worldwide. So you can search by country, postal code, in the U.S., zip code or city, state. You can try to look if you're already looking for somebody by name. You can look if you're looking for somebody you're not sure, but you want a specific specialty or category that you're looking to address. Patients and people who are looking for medical support can search and find people here. You may find these days more people doing the telemedicine consult, so it might just not be limited to your city or state, which is always an interesting challenge to make sure that is listed. I'm not, but if you look under the specialty in the category, you might be able to contact somebody who's within that specialty and find out if they are able to support your needs where you're located and where they're located. I know they have to be insured and approved to do it in a certain state or et cetera. And also, if you're looking for colleagues and to connect with, or in your area, maybe you want to start, we're able to start meeting in person, you want to start a meetup, or you want to start doing a Zoom online brainstorm, or you just really want to connect with others who have the same interests, you can use that list. I've seen people do all of the above. So
absolutely. And the last, second to last, before we get to contact us, clinical guidelines, that's an area, again, that speaks to validity. And I am so excited that you guys have clinical guidelines. We talked a little bit about that when we did a Low Carb USA video. But Adele Height has really put her teeth into this document along with the work of others. But I tell you, she and the board that supports this has really done a great job to provide a tool that'll help clinicians on the front line like myself have a guideline to approach this therapeutic carbohydrate restriction. So talk a little bit about the guidelines.
Yeah, they're really important, especially for someone who might not have the confidence, is just learning, has just enough information that they're not sure, has a patient coming to them looking for support, and they just don't feel like they have enough information. There's 20 pages of resources here. It's in 8 different languages, so it's used worldwide. It's currently going to be translated into more languages, but there's resources for monitoring medications. If the patient's on medication, they need to lower medications as they start restricting carbohydrates, because blood pressure comes down, blood sugar comes down. There's a background definitions that help instill historically how we got here, what's essential nutrition, different levels of carbohydrate reduction. So we can use the term reduction as well as we use restriction. And we find that in the dietitian community, they prefer reduction because a lot in their training, restriction tends to lead them to the idea of the food addiction, or the addictive behavior is going to have trouble with restricting certain things. It's going to lead to, it's all an education process and a mindset, but sometimes the dietitian might think restriction, thinks, oh no, we're taking way too much, it's going to make it harder for the patient instead of easier. So a lot of times they'll use reduction, but they're using the terms that the American Diabetes Association has been using in their medical nutritional therapy. The document for the ADA, it's buried in the 23 pages of documents there as well, but we want it to be used more. What is very low carb? What is low carb? what is reduced carb and what is moderate carb, and how can these all help patients achieve metabolic health, and in what arenas and in what avenues. So, somebody you told a story, a lot of practitioners have said, just reducing sugary drinks or added sugar did this for my patient's blood work, and how they felt and their weight. And so sometimes people can start with moderate carbs and then reduce further depending on what their goals are. So that's a lot discussed. And protein is always very important. So I think when we talk about reduced carbs, some people have pointed out, and we want to make sure that we're mentioning, you want to make sure that you're meeting protein requirements, protein needs, because protein is essential and amino acids are essential. Even carbohydrates may not be, but that's explained here and helps people understand a little bit better.
Absolutely. And of course, after having heard about this wonderful society, be nice to support it. So I see you have a statement of support and a commitment, committing to support. So opportunity for people to put their name down, saying they support this mission, and support means this is more of a statement of support. This is not a financial support. Mm-hmm. Is that true?
That is correct.
Okay.
It's a validation. It's a coming together. It's a community. Mm-hmm. It's acknowledging the amount of work that Adele Height put into this document. She was in graduate school, or in her, getting her PhD while she was doing this. So you understand, working and studying and doing, completing a large task takes a lot of effort. All of the board of advisors who are on the board who lent their experience and expertise. It's supporting that. It's supporting the future work. So statement of support, supporting the mission of what is possible and what can be done with this information, with therapeutic carbohydrate reduction as an intervention, the education and awareness campaigns that go around it.
Absolutely. And of course, the last thing is contact us, and that's pretty obvious what that represents. And I really do think us walking through the site has been very insightful. It's been helpful, and I think a lot of times people just need a little clarity to help them understand what's available to them, and to not know that this society exists while people are out here trying to figure this out would not be ideal. So I just hope that this video reaches as many people as possible. I do want to applaud the work you're doing, Pam. I want to applaud the work that Doug is doing to help spread this message. I think it's a message that will have a huge impact on how healthcare is delivered in our country. So thank you so much for just spending a little time with me today to share this message. And any final thoughts before we wrap up?
I really appreciate the opportunity to share the work that's being done with the Society of Metabolic Health Practitioners. It is a community of healthcare people, and there are some individuals who have joined as members as well. There is a paid membership level that, like you said, like we were saying, gives access to the additional trainings, but there's a lot of free resources. And we just really appreciate, like you said, the work that everybody's doing, because this is a team effort. We just want to reduce the suffering of people. It's terrible to hear a story that's from someone who said, I just wish this information was available to my mom before she suffered so much. Rob Sivas, himself will talk about, and Tim Noakes, and they watched their parents suffer from, things that they could have been avoided. A lot of this information can help reduce suffering going forward. So if you would please join the newsletter. We send information out every other week, twice a month. And join on the social media links. We're on all the social media platforms. That helps connect with each other. I've met so many people through our different channels. They share their journeys with me and us every day. That helps us and each other inspire the future work and share information. So appreciate your time, and thank you again so much, Tony.
Well, it's helping me to fulfill my mission. I've learned from you guys. I've learned from through the Nutrition Network. I've learned from the Diet Doctor. I've learned from Twitter and social media, Doctor, all the various experts out there. And I'm just kind of joining in to spread my message as well. So thank you, Pam, and thank Doug when you chat with him. Let him know that I appreciate everything you guys are doing. And for those who are listening, this is the message of healing. There are people in your community, in your family, even your coworkers who are suffering from metabolic disease. And all they need is a little hand holding, someone that's going to guide them and coach them along and understand the struggle that they face. And the good news is, with the right coaching, the right knowledge, the solutions are right here. So let's make sure we spread this message of hope, of healing. And I just appreciate all of you guys for checking us out today. So we'll wrap up with that. And until we meet again, I want everybody who's listening to be safe, be well, and to continue to protect your nest.